How do you prepare for a CF sweat chloride test? Getting ready for a cystic fibrosis sweat chloride test might seem straightforward, but a few simple steps can really help make sure the results are accurate and reliable. This test is the main way doctors check for cystic fibrosis by measuring how much chloride is in your sweat. Because it's so important, proper preparation is key. First, staying well hydrated is essential. For several days before the test, drink plenty of water to keep your body well hydrated. If you're preparing a child for the test, make sure they finish their usual feedings, whether that's breastfeeding or bottle feeding. Mothers breastfeeding should continue their normal water intake while feeding. It's best to avoid sugary drinks or caffeinated beverages before the test because they can affect sweat production. Next, skincare is important. Avoid applying lotions, creams, moisturizers, or sunscreens on the areas where the test will be performed, usually on the arms or legs, for at least 24 hours beforehand. This helps prevent any substances from interfering with the sweat collection process. If you or your child are taking medications like mineralocorticoids or other prescribed drugs, talk to your healthcare provider before the test. Do not stop any medications without medical advice, as that could affect your health or the test results. It's also important to be feeling well on the day of the test. If you have a cold, fever, or any illness, it's best to reschedule because illness can sometimes skew the results. Dress comfortably and warmly on the day of the test because you'll need access to your arms or thighs, and staying comfortable helps make the process easier. Arrive at the testing center about 15 minutes early to avoid any stress or delays. During the test, a healthcare professional will apply a small amount of a chemical called pilocarpine to your skin and use a mild electrical current to stimulate sweat production. The sweat is then collected on a small gauze or collection device and analyzed for chloride levels. The entire procedure usually takes less than an hour and is painless. You don't need to fast or change your diet before the test, and you can continue your usual eating and drinking routines. Bringing along toys or books for children can help pass the time comfortably. Following these simple steps helps ensure the test is performed smoothly and accurately, giving your healthcare team the best information to diagnose or monitor cystic fibrosis. Remember, always follow any specific instructions your healthcare provider gives you, and don't hesitate to ask questions if you're unsure about anything related to the test preparation.